मिस्टर सुशांत कुमार नायक सीनियर कंसल्टेंट हैं, कम्युनिटी प्रोसेस नेशनल हेल्थ मिशन गवर्नमेंट ऑफ ओडिशा से हमारे साथ जुड़ रहे हैं। ओडिशा में जहां से मटिल्डा जी भी आती हैं वहां 48,000 आशा बहनें हैं जो कि काम कर रही हैं और 2008 से आप नायक साहब इसको पूरा ओवरसी कर रहे हैं। मैं आपसे ये जानना चाहता हूं नायक जी, आपका अनुभव कैसा रहा है? जैसे अभी मटिल्डा जी यहाँ पर अपना अनुभव बता रही थी, 48,000 अभी यहाँ रवि कह रहे थे कि ये संख्या थोड़ी ज्यादा होनी चाहिए गांव-गांव तक आशा बहनों की मदद पहुंचाने के लिए।
सभी को मेरे नमस्कार, अमिताभ बच्चन सर को मेरे नमस्कार। वी टेक केयर ऑफ लॉट ऑफ थिंग्स बीइंग अ पार्ट ऑफ द मैनेजमेंट प्रोसेस। सिलेक्शन प्रोसेस में हमारा ये कोशिश रहता है कि उन्हीं की गाँवों से कोई एक चुन के आए, मतलब एक सिलेक्ट हो के आए, ताकि एक सेंस ऑफ बिलोंगिंगनेस, एक कॉन्फिडेंस कम्युनिटी का आशा के ऊपर रहे पहला। So they needed a person who is with them, उनकी साथ हो और उनका एक कनेक्शन भी फैसिलिटी के साथ बने रहे। And second thing is that in a year we do undertake at least 10 to 12 days of training to build their knowledge, skill and competency, which is extremely essential because now, initially the focus was more on maternal and child health. Now the focus has, along with the maternal and child health, the focus has also shifted to non-communicable diseases, health and wellness approaches and all that. So it is extremely important that our need-based training and capacity development program is in place for all the ASHAs who are working with us. Third is basically their incentives. We have that they receive a kind of performance-based incentive against the kind of number of works they deliver. We in the state of Odisha is having one of the maximum and highest number of incentive provisions in the entire country, and we also ensure that there is no backlog in the process of the payment. We take utmost pride to recognize them and give them award because that's the work they are doing in the field. So we do a lot of awards at the district level, state level for them. So these are some of the things that we try to facilitate so that we build a kind of enabling environment and ecosystem for the ASHA so that they really stay motivated, having a sustained motivation to work for the health and well-being of the people.
Mr. Nayak, this is Amitabh Bachchan.
Namaskar, sir.
You've talked at great length about the selection process and the training process. What are some of the challenges that you face in this process? We'd like to know something about that.
The ASHAs who are located in the difficult to reach habitations, that's the biggest challenge because still there are places where we need to reach to them and in terms of the effort which is input in general areas. So in the hilly areas, the challenges are manifold. Initially, the health program was limited to some extent, but right now there are a number of activities, number of programs. The program strategy has been shifted. So the challenge is basically to equip the ASHA and build her knowledge, skill and competency in all the programs that she is expected to do. And also provide them a good support system and a supportive supervision mechanism to see that we're really providing the mentorship and support so that they perform the best at their particular community.
We are so motivated by the work that and inspired by the work that you and the ASHA workers do. It's very clear to us that the future of our ASHA workers is very correlated with the future of India. Improve conditions for them and increase their numbers by going from state to state. How do we do that?
So first of all, the numbers in our state actually a few years back, when we realized that in the areas where it is not that difficult to operate and the areas which are extremely difficult to operate, we are actually increased the number of ASHAs. We have now even in 200, 300, even 500 population, we have ASHAs. So we try to ensure that the workload and the difficulty they are facing are actually reduces. So that's one of the strategies that we have taken. And so second point, you talked about the incentives. Basically, every year our efforts has been to increase the number of incentives, and we have a provision called assured amount as well. So in our state, this is...
Mr. Nayak, sorry to interrupt. Yes, Orissa is doing a wonderful job, but we still can do much better. So how do we get your government and all other state governments to increase the allocation for the salaries an income of ASHA workers and increase the numbers. You're saying 1 per 300-400. We want 1 per 50. One ASHA worker for 50 families. So I'm just looking ahead. How do we get governments to increase their allocation over the next 5 years? Because the future of India is dependent on the future of ASHA workers.
One of the way could be like we could really enhance the amount which is fixed right now. That is one. And second one is like with the kind of number of activities are increasing. So we can always add on more activities and ensure that they are being paid every month on a regular basis.
Right.
So these are the two things which you can see from.
Very good. I think we'd like to give our commitment that NDTV is right behind you, and we will fight for more and better conditions for all our ASHA workers. They are an inspiration for this country. God bless them. Thank you very much for the work you're doing.
बिल्कुल सुशांत नायक जी, आपका बहुत बहुत धन्यवाद हमारे साथ जुड़ने के लिए।